Whenever we talk about how the human body functions and how it's able to maintain homeostasis in response to stresses and in response to infection, it's all about how do the immune cells and the cells responding to stress send signals to maintain homeostasis, which leads to the question, how is it that immune cells are able to communicate? And how do the immune cell hormones impact overall health? And what does it have to do with any of the pathophysiology? Well, let's talk about that.
Warning. The following presentation contains information that might contradict what you have previously heard, or believed to be true, about how the human body works, and contains material that is not suitable for closed-minded individuals. Enjoy!
And so when we're talking about these immune cells and immune cell supporting tissues sending signals, what we're really looking at is how can they communicate in order to make sure that we're not going into any type of metabolic stress? How is it that they're able to help us maintain our health in response to any type of infectious agent, regardless of whether or not we follow proper hygiene? How is it that we're able to maintain immune functions? And how are we able to utilize vaccinations in order to support immune functions? And what can we do in light of wearing personal protective gear so as to not get infections? When we start talking about this, what we're really talking about is how can we understand what actually causes disease? And this helps us fight any of the misinformation and disinformation that's out there in social media and allows us to have better conversations with our physicians, or if we happen to be a physician, with our patients, so that we have better understanding of the course of care that we can present and that we can utilize. When we start talking about this, what we're talking about hormones. And hormones are simply chemical signals that are going to regulate and control metabolism. These hormones have various types of classifications within them. One type of classification that we're going to see with hormones are things like cytokines. And cytokines is simply the reference given to any type of cellular signal that's going to regulate and control metabolism that's going to originate from non-glandular tissue. In the case here, we're talking about things that are going to originate from immune cells. Now, outside of the cytokines, there are other hormones that are going to come into play that are going to have an immune function to them, that are going to have an inflammatory response to them. And so when we start talking about cytokines and start talking about hormones, what we're talking about? We're talking about interleukins, interferons, growth factors, leukotrienes, complement proteins, as well as adrenal hormones. Things like IL-1, IL-2, IL-3, IL-4, IL-5, IL-6, IL-7, IL-8, IL-9, IL-10, IL-11, IL-12, IL-13, IL-14, IL-15, IL-16, IL-17, IL-18, IL-25, interferons alpha, beta, gamma, TNF-alpha, MCP-1, PA-1, C-reactive protein, leukotrienes A through G, as well as complement proteins, and things like epinephrine, norepinephrine, dopamine, cortisol, aldosterone, and somatostatin. All of these signals will have some sort of regulatory effect on either inflammation or immune cell activation that's going to be involved with our responses to infection or responses to stress. So what type of cells are going to be involved with this? Well, we have things like T cells are going to be involved with this, in which we have things coming away from the regulatory T cells, such as IL-3, IL-9, IL-12, IL-14, IL-17. IL-3, which is going to be involved with causing growth of cells that can become immune cells. IL-9, which is going to, once again, have an effect on generating new cells. IL-12, which is going to cause a proliferation of our natural killer cells, as well as increase in interferon growth if we happen to have a viral infection, as well as promotion of cell-mediated immune cell functions, as well as cell-mediated inflammatory responses in the rest of the tissues. Memory T cells are going to be producing things like IL-3, IL-9, IL-12, IL-14, IL-17, in which we're going to, once again, be promoting growth of other cells, as well as activation of B cells, as well as activation of T cells upon response to a known antigen. We have things like helper T cells, which will be producing things like IL-2, IL-3, IL-4, IL-5, IL-6, IL-9, IL-10, IL-12, IL-13, IL-14, IL-16, IL-17, as well as interferon gamma. IL-2 is going to promote B cell proliferation in particular, and the formation of plasmal and clonal B cells. It's going to promote proliferation and activation of T cells, and it's going to stimulate natural killer cells to become more metabolically active in the fight against infectious agents or the fight against any type of tissue breakdown. IL-4 is once again going to be stimulating proliferation of B cells. It's also going to stimulate eosinophils and mast cell growth, as well as changes in metabolic functions of eosinophils and mast cells. It's going to increase the expression of some of the antibodies, in particular Ig or antibody E, in response to various types of antigens. And it's going to inhibit a lot of monokine productions that's going to minimize inflammation. So what we're looking at when we're looking at the IL-4 coming away from the helper T cells is an activation of immune response and an activation of inflammation. At the same time, helper T cells can be producing IL-10, which instead of promoting inflammation, can actually minimize the amount of inflammation by suppressing cellular responses to immune cell functions, as well as suppressing growth of various types of macrophages. It can also inhibit some of the cytokine productions, in particular cytokine productions that are going to promote complement protein and overall inflammatory responses. The killer T cells are going to be the T cells are going to be activated in response to a chemoattractant and chemotoxic signaling response. These are going to be the ones that are going to be actively engaged with the antigens that are labeled as foreign, that are going to be actively engaged in the immune response necessary to eliminate the interleukins that we're going to see coming away from the killer T cells include things like IL-3, IL-9, IL-10, IL-12, as well as IL-14, IL-16, IL-17, and interferon gamma. Once again, the interleukins that we're seeing coming away from the killer T cells, just like what we saw with the helper T cells, is all about trying to make sure that we have the correct overall level of immune response so that we're able to get the inflammation necessary and the immune cell response necessary in order to eliminate any type of infection that might come into the body. Along with the T cells, we're going to get a host of other types of leukocytes coming into play, or white blood cells coming into play, which include things like the monocytes and the macrophages, the eosinophils, the neutrophils, and the basophils. And if we happen to have any type of vascular injury, the platelets. In the monocytes and the macrophages, we're going to get IL-1s, IL-4s, IL-5s, IL-6, IL-8, IL-10, IL-12, IL-13, IL-17, IL-18, as well as interferon alpha and interferon beta, MCP1, PA1, and C-reactive protein. A lot of these are going to be triggered in a way so that we have maximal amount of inflammation taking place and maximal amount of activation taking place. IL-1 is going to stimulate any type of antigen-presenting cell, as well as activate T cells throughout the body. This is going to trigger global inflammation as well as a fever response. It is known to stimulate the acute response in terms of cellular differentiation within the bone marrow, so as to promote additional immune cells and additional blood cells in terms of growth and maturation. TNF alpha is going to be used in expression of attempting to minimize growth signals while maximizing inflammation signals. It's also going to induce cellular proliferation and the proliferation that is necessary to trigger additional immune cells. It's going to increase distinct responses to growth factors within immune cells while suppressing growth factors within the rest of the body's tissues. C-reactive protein is a protein that is going to be involved with any type of phagocytotic response within the cell. It typically works in conjunction with IL-6. It induces additional monocyte activation and may increase platelet activation that is necessary for any type of vascular response. Eosinophils are going to be the main site of leukotriene activation. Leukotrienes A, B, C, D, E, F, and G. The leukotrienes are going to be involved with activation of other types of immune cells. And these are going to be hormones that are coming away from one of the essential fatty acids. Basophils and neutrophils are going to be involved with global inflammatory responses and are also going to be producing distinct types of hormones that are going to lead to greater amounts of inflammation within the tissues, in particular serotonin and dopamine. Platelet activation, as well as clotting issues, will activate PA1 as well as C-reactive protein, which are going to lead to vascular changes and vascular spasming. It's also going to lead to a aggregation of platelets in the clotting that takes place in response to any type of vascular injury. We also have a whole host of what are referred to as complement proteins, and we basically can break these complement protein classes down into a few distinct. These include the binding proteins such as C1q, MBL, C3b, C4b, as well as activating enzymes such as C1r, C1s, C2b, BDB, D, as well as MSP1 and MASP2, as well as our inflammation mediators such as C5a, C3a, and C4a. But then we also have complement proteins that will act as a membrane binding protein or an attacking protein, such as C3b, C4b, C5b, C6, C7, C8, C9, as well as regulatory proteins such as C11NH, C4BP, CR1, MCP, DAF, as well as factors H, I, and P, and CD59. The complement system is broken into three distinct activating pathways. This includes the classical pathway, the lectin pathway, as well as the alternate pathway. In the classical pathway, we're going to bind onto either an antigen or an antigen that's been labeled with an antibody. In the lectin pathway, we're going to bind onto a mannose within the pathogens that's going to lead to secondary activation. In the alternate pathway, we're going to be dealing with some type of injury that's going to trigger a membrane-bound type of complement protein. Whenever we get these complement protein activations, we get a conversion from an inactive form to an active form. This inactive form to active form is going to lead to either inflammation or is going to lead to some sort of cell response, which is going to lead to what's referred to as cell lysis. And cell lysis occurs due to the breakdown of the cell membrane, allowing for water to move in a chemotaxic response that's going to lead to the death of the pathogenic entity. In all these complement protein pathways, what we're doing is we're accentuating the inflammatory responses that are generated by the other hormones and other cellular signals coming away from either the immune cells or from adrenal signals. The adrenal signals are going to be based off of whether they're coming from the adrenal cortex or the adrenal medulla, which include things like epinephrine, norepinephrine, dopamine, cortisol, somatostatin, and aldosterone. Epinephrine, norepinephrine, and dopamine are going to trigger a global response that leads to a non-specific immune. This is also going to lead to things like fight or flight response, as well as overall stress response that we see during the initial or the acute stages of response to infection or response to injury. Whereas cortisol is going to come away from the adrenal cortex and is going to be leading to a more specific response by controlling various types of inflammatory proteins, typically through regulating the NF-κB pathway and activating the IKB pathway within various cells of the body. Now, sometimes we get an irregular response within the complement proteins, as well as within the cytokine signals coming away from the immune cells, which leads to something referred to as a cytokine storm or a cytokine release syndrome. The cytokine storm or cytokine release syndrome is where we have an irregular immune response taking place due to uncontrolled and dysregulated cytokine signaling. This is one of the things that leads to overall immune response as well as acute immune issues, in which we can have an irregular triggering. That irregular triggering is going to lead to increased amounts of the inflammatory interleukins and the inflammatory cytokines, which leads to hyperactivity within the immune cells without regulation on a negative feedback. When we start having additional and additional and additional responses, what ends up happening is we end up having overstimulation of the systems into an inflammatory state. This overstimulation can lead to things like rashes, can lead to things like edema, can lead to things like nausea and vomiting and diarrhea, can lead to things like arthritis, can lead to issues within the nervous system, such as confusion, can lead to some of the neurodegenerative diseases, can lead to pulmonary edemas, can lead to dyspnea and hypoxia, can lead to acute respiratory distress, can lead to cardiomyopathies, can lead to tachycardia. A lot of the things that we think about or that we attribute to negative impacts in terms of vaccinations or negative impacts in terms of disease can come away from these cytokine storms. These cytokine storms are very rare, but they can occur. And since they can occur, a lot of people will attribute adverse effects from the cytokine storms to the adverse effects that we might see coming away from some of the vaccinations or come away from some of the acute exposures to pathogens that we encounter. Well, thanks for watching. Thanks for listening. Hope you got a little bit out of the discussion about inflammatory markers and inflammatory hormones. There's a lot more out there in terms of what we're producing as it relates to the immune responses in the body. Please watch for upcoming videos on different diseases as well as different issues as it relates to inflammation and pathophysiology. Please make sure you're following us on all the various platforms here on YouTube as well as on the podcast. The written stuff in Substack as well as the quick takes on Instagram and on Threads.